Good morning, everyone. This is Heiko from the Acupuncture and Air Show in Hastings, New Zealand. We've got our special series coming up this year in 2021. We're having a series of interviews with a practitioner from Hamilton, and his name is Kane Monrad, up from the Waikato region. And we're going to be talking a series of shows with him, acupuncture and various women's disorders, particularly related to pregnancy. Good morning, Kane. How are you?
Hey there. Thanks for having me on the show again.
That's all right. So how's everything in Hamilton? The same? Sort of damp and mosquitoes and, you know?
Actually, yes, it's a bit foggy today, actually. I can't see much to pass the letterbox.
Yeah.
So,
So nothing's changed since the last time we spoke. Yeah.
Well, apart from the extra Chinese restaurants we have here.
Yeah. But anyway, this is the first show that we're going to be talking about is a topic that maybe not a lot of people are aware that acupuncture actually can help or is used for. And as we know, many people have heard acupuncture is used for back pain and it's used for headaches. But today we're going to be talking about how it can be used to help women to prepare for birth. Can you give us any comments on that, sort of, Kane?
Yeah, for sure. I mean, we treat clients basically before, during, and after pregnancy. But one of the main keys that I tell people is at the beginning of the 36 to 37 week for birth preparation, we recommend the treatments to help the uterus and the cervix become, say, ready for birth, so to speak.
Yeah.
And get it. And as we get closer to labour, we can help dilate that cervix before labour begins. And this is sometimes called cervical ripening.
Yeah, I know the technical word for that. So the basic goal is just help the baby to come on the due date, and it can help make the birth easier. Have there been any studies in the Western world? I guess it must be a hard thing to try to prove.
Yeah, for sure. So actually, one of our acupuncture members in Wellington, Deborah Betts, she is a researcher and an author of the Essential Guide to Acupuncture and Pregnancy. She says that many midwives report that doing this course of pregnancy acupuncture reduces the time in labour and less medical intervention. And actually, come to think of it, if people do follow through with this, and other acupuncturists I know say the same, they say it can be under 7 hours labour. So it's not for everybody, but it can be, which is good for them and good for the midwife.
Yeah, because I know with my own patients, and and they've heard from another midwife or maybe from another female friend, a girlfriend or whatever, and they've tried it, and then they've had those sessions the month before. And then they'll say, look, I said, I know it was the acupuncture, but they just feel that it did it. And then I've had other women too who it might have been their second or their third child, and they say, oh yeah, definitely with the acupuncture, it seemed to do something. So,
sure.
What about just tell us a bit about the regime or what's involved?
Sure. Yeah, sure. So I say once a week, from 36 weeks, basically until they give birth. And the treatments are around 25 minutes to 30 minutes, not too much longer, just because I find that if they're lying on their side, it's a little bit hard for the hips. But also sometimes we can have them sitting up as well. But just a short treatment with a great effect.
Right. Now, it's just one of those things in terms of the time and availability for treatment and that. I know that sometimes patients have other concurrent issues just before childbirth, and so what I might do is I might be treating them, twice a week. Sometimes they have carpal tunnel or have blood plexiform, but as you're probably experienced with, and is that many women have stress just before the birth. Can you give us any advice there, or any sort of feedback? What happens with you there?
Yeah, I have patients who had a history of late birth, and then they tend to make a real effort to optimise their health during the course. Mm-hmm. And that 1 month before the due date works fantastically good.
Yeah. And what I've even found is because sometimes I've had patients and then they've only found out about it like, in week 38 or week 39. And then they've still come in, and then they might have had 2 or 3 sessions a week, and still it's like they report success, or they can feel a different change. Have you had any feedback like that?
Yes, absolutely. Yep. So I take them at those times as well. Some treatment better than no treatment, I say, but
Yep.
but I get asked this too, and I have these 2 major successful points that we would use
Yep.
for the pre-birthing treatments. One of them is stomach 36 or Zusan Li, and another one is gallbladder 34, which is Yinling Chuan. Now, the stomach 36 is used as a pre-birth point. This is due to the tonifying and blood nourishing properties of this point. So therefore, if we can tonify the chi, nourish the blood, this gives an overall enhanced energy and stamina, and this is what is necessary for a healthy labour.
So what I use was stomach 36, because as you know, the name means 3-leg mile, and it has this traditional use that if you needle it, you have more energy, that you can walk an extra 3 miles, when you're tired.
Right, yeah.
When you're tired at the end of the day. And I use it a lot for athletes and runners and, gym people training and stuff like that. And so then I just say, look, it's the type of point, it just gives you, more energy to help you to get through the birth, to push, and so you don't conk out halfway through and then you go, oh, I'll just have a cesarean, Now, what about that other point you mentioned, gallbladder 34?
Yeah, so again, a very good pre-birth point. This is a master point for the tendons and ligaments, so it helps soften the ligaments prior to labour. So anything to help that pliability and to stop tearing and things like that, then that's the point to go to.
Yep.
Yeah, exactly that. There's a combination that's fantastically good.
Yep. I know with that point, gallbladder 34, there was some a research study or an observation in the clinic where they got a bunch of people, not pregnant women, but then they just measured how flexible or how non-flexible they were, and then I think they did that point every day for 10 days or something, and
right.
and then they found that then they actually had become more flexible, touch their toes more easily or whatever, without having done any other stretching and stuff before. And I think that just emphasises that the ability that it has, just to open up that pelvis and relax it to prepare for the birth. Now, what about, and as we know, stress affects everything and everybody, but what about with pregnant women, particularly if it's their first child? I mean, what can you suggest there?
I mean, a lot of the time they are anxious and nervous about childbirth, which is why they're coming for the 36-week plan as well to help things along, help things better. But there's always that little bit of stress and tension in the body, and so there's a couple of points we would use for that too. And one of the points is we call the Yin Tang, or it's an extra point on the forehead, and the actions are really, really powerful, and it calms the mind, calms the spirit. And it just takes the edge off the emotional restlessness and anxiety. It helps really calm the mind and tension. Also helps good for sleep and almost like a mind reset, Heiko.
Yeah.
Yeah. But when I was training in Australia, the acupuncturists, wouldn't matter what you were coming for, would just put Yin Tang and another point at the top of the head, just because everyone's so stressed.
Yeah.
So busy, so everyone sort of needs that point.
Yeah.
So it's a perfect point for them, and a very safe point as well.
Yeah. Now, these days, I mean, we've got, there's hundreds of types of social media advertising and things, but how are you finding with your patients? How are they finding out about you? Is it more so from other patients or from midwives?
Yeah, I mean, if I look at my books, I could say 60 to 70% of my client base is fertility-based or pregnancy-based as well.
Yeah.
So I have a couple of midwives in Hamilton that refer me, but basically it's word of mouth, and it's a strange thing, Heiko, because, I might have someone in Tauranga that will travel once a week or once every 2 weeks, and I say, look, there's acupuncturists over there, why don't you go to them? And they say, well, you helped my friend fall pregnant, so I want to come to see you. So word of mouth to me, it seems to be working quite well.
Yeah, but what I definitely have found is just that the knowledge that acupuncture can help these things, it's getting out there to the midwives, and so there's sort of basically sort of almost by default now saying, oh well, do some acupuncture. So yeah, which has been a great thing. And whereas I find I do get quite a mix. I get a mix of from other patients that have then referred their friends, some midwives, but then also because they've heard about it, or they've read about it from somewhere else. They've read something favourable about it, and they said that there have been a number of research studies now. So then they will find you.
Sure.
And particularly, say, with some of my patients, I know I've treated them, say, for morning sickness, and then they sort of think, well, that helped for that.
Yeah,
so
yeah.
It gets their trust, and say, okay, well, I'll believe you for then. Okay, we'll do this. Now, can you just tell us a bit about the acupuncture and sort of early stage pregnancy, and just so we can get a bit of an idea there.
Well, like you say, Heiko, that a lot of them will come for that morning sickness as well, but there's actually a whole lot of other conditions or problems that can occur during the whole process, right? And nausea is one of them, or lower back pain or pelvic pain, headache, migraines, heartburn.
Carpal tunnel, varicose veins. Yeah, I know it's a big list.
Yeah, all those things. And not only that, itchy skin in pregnancy.
Yeah.
That's another one as well.
So listen, we're just coming up near the end of our show here. So, but what about the next show? We talk about that problem, itching during pregnancy, because for whatever reason, I've seen a lot of that, and I think these patients just come out of absolute desperation because, and I think it's a wise choice because the doctors don't want to prescribe heavy drugs or something to stop the itch, and they sort of say,
absolutely.
And so, the acupuncture can be a great alternative to this. So, we'll get you back on the show to talk about that.
Yeah, no, happy to discuss this with you, and we can go from there. And as you say, it's a gentle and effective way without prescribing any medication at this stage of and through the pregnancy.
Good. All right. Just thanks for joining us on the show. But just let us know your phone number there, and then I'll also put your link to your website up on the comment section so that people in the Hamilton area, Waikato region can contact you.
No problem. So my phone number, the best way to contact me is on 027 499 831, and my address is 25 Somerton Drive, Hamilton, Rototuna.
All right, well, that's great. All right, well, we'll look forward to talking to you on the next show. We'll talk to you soon. And, and to finish off the show, you're probably too young even to remember the song, Kane. You probably wasn't even out when you were born, but we got a Supertramp song.
No problem.
All right, great.
Hey, thanks for having me.
Okay, bye.